Hello, everybody. Welcome back to the show. We are here with Dr. Rob. Dr. Rob, how you doing?
Great today.
Every time you come here,
He's always great.
Yeah.
Right?
Oh yeah, I have to be.
That's the
Exactly.
can-do attitude that we need.
He's healthy.
And how do we become healthy? You are here to give us some more insight. What are we talking about today? What are we focusing on?
Today we're talking about a technology I actually use in my office. It's called a nervous system scan or a thermal scan.
Okay.
And the idea of this technology is going to scan your back to see if there's any pressure with your nerves, on your nerves, from your spinal bones.
Okay, but this scan does not tell you where the pain is happening, right?
No, it actually has nothing to do with pain.
Yeah.
Pain is totally separate. We just want to know how well your brain is communicating with your body.
Okay, so you're going to try it on me?
Yeah, we can try to scan on you today.
So we're going to find out how Jacqueline's brain is communicating with her body?
Is that right?
Yeah.
Okay.
All right, this will
Technically.
be interesting.
Weird. So
Okay.
tell us about the actual technology and what it will be doing.
Sure. It would probably be best to look at the spine that we have over
spine?
here to explain the technology. You can see these orange spaghetti-like nerves coming out from in between the bones. Those nerves are like telephone lines that deliver messages from your brain to your body, telling your body what to do to be healthy. But what happens with our average daily life stresses that we incur is that bones can get a place in our back, put pressure on those nerves, and interfere with the messages traveling from your brain to your body, and literally affect anything in your health.
This looks like cheddar cheese, actually.
Yeah, it
It
does.
really does.
Okay, so the scan, though, I mean, you came on a few years ago and you did something completely different.
Yes.
This is an upgraded version?
This is an upgraded version. The nice thing about this scan is that you can move while you're doing it. So if we want to scan infants, it won't throw off the readings.
Okay. So you're just, how much of my back do you need?
We're going to scan your neck today because the
My
scan
neck,
has to
okay.
be done on the skin.
Okay.
Doesn't she need to put on that paper gown that they have in the offices?
Only when we're actually in the office,
I
because if
see,
we want to
okay.
scan the whole back, yes, we would need a gown.
Right.
No
But
gown
today-
needed today.
No, today we'll demonstrate just on the neck.
Okay.
Yeah, because Jacqueline does have neck issues.
All right.
I
So-
do, and I'm not sure if this will show.
Well, exactly.
You know what I mean? It's
Exactly. I was telling Jacqueline before the show that even though she may have some neck issues, the pain may not be associated with the nerves.
I
So
see.
we're going to find out.
okay. I'm interested to know.
Okay, so all you have to do is hold still.
Okay.
What are those sounds? What do those sounds mean?
That's my speedometer. That's
Your
actually telling
speedometer.
me
How fast are you going?
Exactly. We want to roll at an even rate here to get good readings off of your spine.
Right. C1.
What's interesting to note is
Huh.
that this is actually measuring temperature coming off of the skin.
Looks more like a price checker. How much is she worth?
Is that
All right,
it?
and we're done just like that.
All right.
And that's my spine.
Well, you can see on the computer screen, yeah, here's the readings that we have. And guess what? Your scan actually turned up pretty good. What we want to see,
Yay!
You passed.
yeah.
Oh, thank goodness. Okay.
What we
did
want to
you-
see are as many white bars as possible on the screen. And then there's a progression. Green is mild nerve pressure, blue is moderate, and red is severe nerve pressure. And you can see you have one mild reading up at the top of your spine. Now that happens to be a very important level of your spine, and if you're wondering what that nerve controls at that level of your spine, the computer will tell us. So it says on here that you could be susceptible to headaches, ringing in your ears, or ear infections, or dizziness, vision disturbances, sinus or nasal congestion, or susceptibility to seasonal allergies.
Interesting.
Is it true? I was just doing a little bit of reading it. Is it true that this technology was developed originally for NASA, for astronauts?
Yeah, NASA developed it because they wanted to study the astronauts' spines when they were doing simulated takeoffs, because there's a lot of pressure and force on the spine
Right.
when the shuttle's taking off, and they wanted to make sure they weren't doing damage to the nerves.
Can we go back to my spine?
Yeah, of course.
Okay, I just
Yeah,
want to
open
have a
up.
look and ask you about these little boxes. I have
Yeah.
4 on this side and I have 2 here. Does that mean anything?
Yeah, the sides that the boxes are actually appearing on is just different temperature readings. As the scanner was
okay.
going up your neck, it was picking up heat differentials on either side, and where there's more heat, the boxes will appear on that side.
Oh, okay. So after you get this reading from a patient, how does this help you, diagnose their problem areas?
Exactly. It lets us know if chiropractic care has the ability to help with more than just relieving back pain. For instance, with your scan, if you do suffer from headaches or sinus problems, you could say, you know what, Dr. Rob, I do have sinus issues. And then I would say, well, we have a correlation here that we have the possibility that if we do treatments and take the pressure off of that nerve, your sinus problems may go away. There's a
Oh.
possibility.
And when you talk about treatments, what kind of treatments? How would you work through that?
Exactly. We have our standard chiropractic treatments that we use in the office to realign the bones and get the pressure off the nerves. Treatments vary between different offices and so on, and that's a whole different
Yeah.
segment in itself.
Yeah, exactly. What about George wearing his suit? It wouldn't work through the suit, would it?
No, we have to do it directly
Okay.
on the skin.
Okay.
I got to get naked? Give me a paper gun.
No. And when we look at that spine, in terms of how your spine should be aligned, that's what it should look like, right?
Hopefully.
Yeah.
Yes. Now, when I talk about misalignments of the bones, it's very minimal. We're talking a few millimeters. So the bones don't get out of alignment too much. But your nerves are very sensitive tissues. The weight of a dime of pressure will interfere with the messages.
Wow.
Let me ask you this. Okay, this is great to kind of deduce what's happening internally, but what are other things that we should be doing every day just to make sure that we stay on the right path with our spine and just our general health?
Exactly.
Yeah.
Well, what I talk to my patients about are avoiding the stresses in our lives that tend to cause misalignments in our spine, posture, emotional, mental stresses of work, and so on. You can't avoid all the stresses in the world, but try to minimize them as possible. So that's possible. Stretching, eating a healthy diet, drinking enough water, eating the right foods, of course, and avoiding sitting at your computer for too long or long drives. Take breaks, get up, move around.
Can stretching, I know I have bad posture and I naturally slouch. And I know that when you correct your posture, that will reduce the risk of headaches and all of these ailments that you're having because of your bad posture.
Exactly, because when you correct your posture, you're actually reducing the chances of you having misalignments.
And what about stretching? Can it reverse what you're doing to your spine?
It can, stretching, but most importantly, strengthening the right muscles in your back to hold proper posture.
Okay.
Very
I'm going to
nice.
try to stand up straight for the rest of the show.
Oh, if you're going to do it, then I'm going to
And you should too.
I'll be watching you.
Okay. Oh, okay. MurrayChiropractic.com is the website. Thank you for the scan.
No problem.
Very useful information. Up next, we have a musical performance by Juno-nominated Humble right after this break.